Now, am I audible you clearly? Okay. So, in the last lecture, what we have seen? In the last lecture, we have seen that what are the sympathomimetic drugs. Now, in the continuation with that lecture, we are going to start sympatholytic drug. What do you mean by sympatholytic drugs? These are the drugs which will block the actions produced by sympathetic nervous system. So, they are showing you opposite, or they are blocking the whatever actions is given by adrenaline and noradrenaline. What are the different adrenergic receptors? Okay, there are two kind of receptor in the adrenergic nervous system. Okay, so adrenaline, noradrenaline, they will act by two kind of receptor. First one is the alpha receptor and second one is the beta receptor. Okay, in the alpha receptor we have two subtypes, alpha 1, alpha 2, and in the beta receptor we have three subtypes, beta 1, beta 2, beta 3. We have seen their location also, we have seen their nature. Most of them are G protein coupled receptor. Okay, so stimulatory receptor they will act by increasing the phospholipase activity. They will increase the phospholipase and they will do the phosphorylation of phospholipase C and will increase the intracellular secondary messenger, that is a diacylglycerol and inositol 3 phosphate. In turn, that secondary messenger will generate influx of calcium channel. Okay, influx of calcium ion inside cell, and that will be stimulatory action. And in opposite to that, inhibitory action will be shown by uh, those GPCR which will which will decrease the intracellular cyclic AMP level. Okay, so that is stimulatory and inhibitory. Now, sympatholytic drugs. These are the two types. Either they can block your alpha receptor, or they can block beta receptor, or they can block both alpha plus beta receptor, or they can block selectively alpha 1, selectively alpha 2, or non-selectively alpha 1, alpha 2, or they can block selectively beta 1, beta 2, beta 3, or they can block all the beta 3. So those drugs which can selectively block one kind of receptor, they are known as a selective blockers, and those which are not selectively blocking anyone, they are blocking all the family. Okay, so for example, any drug is able to block beta 1, beta 2, beta 3, then we can call it as a non-selective beta blocker. And if any particular drug is able to selectively block only beta 1 receptor, then we call it as a selective beta 1 blocker. Right? Are you getting or not? Just try to reply me. Okay, so that is nothing but the selectivity and non-selectivity. So adrenergic blocker. Now first we will see alpha blockers. So you know that there are two kind of receptor, alpha 1, alpha 2. आपको मालूम है कि यहाँ पे दो receptor है, alpha 1, alpha 2. Adrenergic blocker, that is alpha blockers. Later on we will see the beta blockers also. So first alpha blockers, in that you have three classes of alpha blockers. Okay, so first one is the non-selective alpha blockers. As the name indicates, non-selective means they can block alpha 1 as well as alpha 2. So we are not sure whether which kind of alpha receptor they will block. So they can block either alpha 1, either alpha 2, or they will block both, or they may have a greater affinity to alpha 1 or alpha 2, like that. So they are non-selective in action. They can block both the alpha receptors. So in that also you have three subtypes. First is the haloalkylamines. Alkylamines containing halogen atom. So example is dibenamine and phenoxybenzamine. Then second class is natural compound, that is ergot alkaloids. Third class is your imidazole derivative like pentolamine and tolazoline. Tolazoline, pentolamine. These are the imidazole derivative. Remember, इसके ऊपर एक बार क्वेश्चन पूछा था. Which one is blocker with imidazole ring in the structure? That is a tolazoline. Okay, tolazoline, pentolamine. So these are the non-selective beta block, non-selective alpha blockers. Okay, haloalkylamines like dibenamine and phenoxybenzamine. Then natural compound like ergot alkaloids. Then imidazoline derivative like pentolamine and tolazoline. Okay. Then second class is selective alpha blockers, selective alpha 1 blockers. That means these kind of drug only block the selectively alpha 1 receptor. Okay. आपको मालूम है alpha 1, alpha 2. Alpha 1 is a stimulatory in nature, alpha 2 is a inhibitory in nature. ठीक है, मतलब जो भी alpha 1 का एक्शन होगा वो stimulatory एक्शन होगा, alpha 2 का inhibitory होगा. ठीक है, so alpha 1 कहाँ पे है मैक्सिमम? So alpha 1 receptor is located on the your peripheral blood vessel. Stimulation of alpha 1 receptor will increase the peripheral resistance, right? And in turns it will also increase the blood pressure. So that's why alpha 1 blocker, selective alpha 1 blockers, they have potential use in the hypertension. Okay, so that's why selective alpha blockers, they are used in the hypertension treatment of hypertension. Okay, so what are the selective alpha 1 blockers? They will block the alpha 1 receptor. And कि ये क्या हो रहा है एग्जैक्टली, अल्फा 1 ब्लॉकर, अल्फा 2 ब्लॉकर, सिलेक्टिव नॉन सिलेक्टिव. देखो एड्रेनालिन, नॉर एड्रेनालिन, दीज आर द न्यूरोट्रांसमीटर ऑफ सिंपैथेटिक नर्वस सिस्टम. ठीक है, जो सिंपैथेटिक नर्वस सिस्टम का न्यूरोट्रांसमीटर दोनों है, एड्रेनालिन, नॉर एड्रेनालिन. ठीक है, तो वो रिलीज होके कहाँ पे जाएंगे? वो रिलीज होके जाएंगे उनके रिसेप्टर पे. उनके रिसेप्टर कहाँ पे? डिफरेंट डिफरेंट ऑर्गन्स पे. अभी उनका एक्शन दिख रहा है. मैंने एक स्टोरी बोला था आपको कि सपोज दैट यू आर इन जंगल एंड इन फ्रंट ऑफ यू suddenly there is one tiger. So what will be your action? So your brain will be stimulated, your heart rate will go increasing, your blood pressure will be increased, your pupil size will be more, so mitosis will be there, your glycogen store, glucose level of blood body will be more, skeletal blood vessel will be dilated, your digestive system will be suppressed, your urinary and defecation process will be depressed. Okay, so this will be the action when you will suddenly see a tiger in front of you. So now that tiger is replaced. Okay, so पुराने जमाने में कैसा था कि पुराने जमाने में जंगल थे, टाइगर थे, लोग जंगल में रहते थे, मतलब लोग गांव में रहते थे. गांव में टाइगर भी होता था, शेर भी होता था, लोमड़ी भी होती थी. लेकिन आजकल क्या है कि द टाइगर इज रिप्लेस्ड बाय योर समथिंग एल्स. ठीक है, द टाइगर इज रिप्लेस्ड बाय योर, सपोज दैट द टाइगर इज रिप्लेस्ड बाय योर बॉस, द टाइगर इज रिप्लेस्ड बाय योर एनिमी, the tiger is replaced by your jealousy, the tiger is replaced by your overthinking. जो आप ज्यादा थिंक करते हो, जो आपका बॉस होता है, जो डिजायर होता है आपका, वो मान लीजिए कि वो टाइगर है, अभी वो दिख गए आपको तो आपका ब्लड प्रेशर बढ़ जाएगा. ठीक है, सो ब्लड प्रेशर बढ़ रहा है, आपका हार्ट रेट बढ़ रहा है. सो दैट ओके, सो दैट्स व्हाई दैट टाइगर इज रिप्लेस्ड बाय आर्टिफिशियल टाइगर लाइक योर बॉस, योर ओवर थिंकिंग, योर ओवर डिजायर, then your jealousy, then your hatred, then your enemy. ओके, जैसे ही आप आपके बॉस को देखते हो आपका ब्लड प्रेशर बढ़ जाता है कि वो कब जाने क्या कौन सा काम देगा. ठीक है, जैसे आप अपने दुश्मन को देखते हो तो आपका ब्लड प्रेशर बढ़ जाता है कि क्या कर रहे हैं, करने वाला है. ठीक है, आपका डिजायर, आपका हेट रेट, आपका थिंकिंग कैपेसिटी. सो दीज आर द न्यू टाइगर्स एंड दैट्स व्हाई व्हाट इज हैपनिंग. सो इन अभी क्या हो रहा है कि अभी आपके सामने रियलिटी में टाइगर नहीं है, लेकिन टाइगर आपके माइंड में है, तो आपका ब्लड प्रेशर क्या हो रहा है? ज्यादा हो रहा है. दिस इज द रीजन बिहाइंड द ब्लड प्रेशर. एंड नाउ इंडिया में बहुत सारे लोग है कि ब्लड प्रेशर से, डायबिटीज से सब मतलब अफेक्टेड है. सो ब्लड प्रेशर एक्चुअली इट इज नॉट अ डिसीज, इट इज अ स्टेट ऑफ माइंड. ओके, सो एक्चुअली इट इज नॉट अ डिसीज, इट इज अ स्टेट ऑफ माइंड एंड इट इज इंक्रीजिंग बिकॉज of malfunctioning or extra, not malfunctioning, it is a extra or overactivity of your neurotransmitter. Overactivity क्यों हो रहा है कि आप पहले जमाने में आप काम करते थे, रिलैक्स जाते थे खेत में, आप जो भी हल चलाना है, जो भी फिजिकल वर्क करना है वो करते थे और नॉर्मली बाकी सो जाते थे आगे. आजकल आपका मेंटल स्ट्रेस ज्यादा बढ़ गया है. ठीक है, तो मेंटल स्ट्रेस बढ़ गया है और अब वो एनिमी ज्यादा बढ़ गया है, कंपटीशन बढ़ गया है. तो आपका कॉम्पिटिटर है, आपको मालूम है कि ये करने वाला है, ये रात तक जागता होगा स्टडी करने के लिए, मुझे 12 नहीं, मुझे 2 बजे तक जागना है. आपका जो है कॉम्पिटिटर या फिर बॉस, ये जेलसी, हेट्रेड, these things they are increasing your adrenaline level. Okay, continuously they are stimulating the sympathetic nervous system, so you are getting adrenaline, noradrenaline over there, and that's why you are getting blood pressure. So adrenaline, noradrenaline will go on the alpha 1 receptor in the blood vessel, they will compress blood vessel, increase the peripheral resistance, and that will increase your blood pressure. So that's why alpha 1 blocker. So alpha 1 blockers, these are the drug that will selectively block the alpha 1 receptor, means वहां पे ब्लॉक कर देगा alpha 1 receptor को. तो alpha 1 receptor का ब्लॉक हो गया तो एड्रेनालिन कितना भी रिलीज हो गया, तो वहां पे वैसोप्रेसर एक्शन नहीं दिखाएगा और वहां पे पेरिफेरल रेजिस्टेंस नहीं बढ़ेगा और आपको हाइपरटेंशन नहीं होगा. ठीक है, so that's why selective alpha 1 blockers are used. Okay, so these are nothing but the selective alpha 1 blockers. For example, prazosin, terazosin, doxazosin and indoramine. So remember alpha 1 blockers, selective alpha 1 blockers, prazosin, terazosin, doxazosin, then indoramine. इसके ऊपर एक बार क्वेश्चन आया था जीपीएट में, identify one of the following is a alpha 1 blocker. So prazosin, terazosin, doxazosin, indoramine. Okay, and non-selective you have to remember dibenamine, phenoxybenzamine, pentylamine, and tolazoline. Okay, then selective alpha 2 blockers. So example is yohimbine. Okay, but this selective alpha 2 blockers does not have much application in the therapeutics. Selective alpha 1 blockers definitely will have application in the therapeutics. They are used as an anti-hypertensive agent. Okay, remember why I am giving much emphasis on this classification, because they have already asked the question on this classification. Okay, so you have to remember the selective alpha 1 blockers. So just try to remember zosin. So prazosin, doxazosin, then terazosin. Okay, so zosins are nothing but the alpha 1 blockers. Okay, so in that also you have to remember indoramine is also one. So rest of the things are not important. Now this is the classification of adrenergic blocker. Okay, alpha blockers. Now another, there is one beta blockers. We will see that in upcoming slide. So before that we'll see individual drug now. So dibenamine and phenoxybenzamine. Okay, they are not much used clinically, but you have to see whatever is important point. So okay, so they will block the alpha receptor non-competitively. They will block the non-competitively alpha receptor, alpha adrenergic receptor. So non-competitive blockage of alpha adrenergic receptor. Phenoxybenzamine is a more potent than your dibenamine. Remember, phenoxybenzamine is a more potent means its activity is same, but the dose required is very less. Okay, so phenoxybenzamine is a 6 to 10 times more potent than dibenamine in this perspective. Which perspective? That is in the blocking action. Okay, so phenoxybenzamine, the dose required of phenoxybenzamine to block the alpha receptor is very less as compared to dibenamine. That is the meaning of that. Phenoxybenzamine is a irreversible antagonist. Irreversible antagonist of alpha 1 and alpha 2. We are seeing non-selective alpha blockers. So these will block alpha 1 as well as alpha 2. Just remember. Okay. So they are the irreversible antagonist of both alpha 1 and the use of these drugs administration of adrenaline result in Dale's vasomotor reversal. Means what? So I have already explained you Dale's vasomotor reversal. But instead of giving ergot alkaloids, we are using here alpha 1 blocker. Right? Okay. So you are using here alpha blockers instead of using ergot alkaloids. So that is a result in Dale's vasomotor reversal. Then now phenoxybenzamine is a prodrug. Okay. So it is a prodrug and it is converted into active metabolite. That is a diethylene ammonium. Okay. Diethylene ammonium. Okay, so phenoxybenzamine is a prodrug and it is converted into active metabolite, that is ethylene ammonium. Okay, ethylene ammonium by process of cyclization. So ये जो phenoxybenzamine है वो उसका मेटाबॉलिज्म होगा बॉडी में, साइक्लाइजेशन होगा और आपको एक एक्टिव मेटाबॉलाइट मिलेगा. कौन सा? इथिलीन अमोनियम. ओके, इथिलीन अमोनियम, रिमेंबर. Okay, so they can prevent the arrhythmia, but they cannot reverse the arrhythmia. So these drugs can prevent the arrhythmia, okay, but they cannot reverse the arrhythmia. They have property. They have non-specific alpha blockage, and also therefore, in addition to alpha blockage, they also antagonize the actions of acetylcholine, histamine, and 5-hydroxytryptamine. Means they are blocking alpha 1, alpha 2 receptor, but in addition to that, they are blocking other neurotransmitters also. Okay. So what are their adverse reactions? Due to antagonism of these three, antagonism of acetylcholine, histamine and 5-hydroxytryptamine. So what is desired over here? इनसे क्या आपको एक्सपेक्टेड क्या है फिनॉक्सीबेंजामाइन और डायबेनामाइन से? इन्होंने सिर्फ उनका जो काम है अल्फा ब्लॉकिंग, तो वो उधर ही अल्फा ब्लॉकिंग ही करना चाहिए, बाकी का एक्स्ट्रा काम नहीं करना चाहिए. बट दे आर डूइंग एक्स्ट्रा वर्क. That is the antagonization of your acetylcholine, histamine and 5-hydroxytryptamine. So those antagonism will give you adverse effect. Okay, so adverse effect is because of the blocking of these three. So whatever adverse effect are there, like meiosis, then dryness of mouth, nasal stiffness, then inhibition of your ejaculation, palpitation, postural hypotension, nausea, vomiting, is because of the blockage of these three. Now just remember over here, phenoxybenzamine is a prodrug and it is converted into ethylene ammonium, ethylene ammonium, that is the active metabolite by process of cyclization. And in addition to alpha blocking activity, they used to block these three receptors, that is acetylcholine, these three neurotransmitters, acetylcholine, histamine, and 5-HT. And because of that, they have serious, not serious, they have these kind of adverse effect. Dehydrogenated ergot alkaloids. Okay, so you know that ergot is a fungus. Okay, it is a fungus developed on the ray plant of ergot Claviceps purpurea family, Claviceptaceae. Okay, developed on the ergot ray plant. We have seen in the pharmacology. So you will have over there indole alkaloids. So they are used to treat orthostatic hypotension. Orthostatic hypotension. Okay, they are used orthostatic hypotension due to autonomic न्यूरोपैथी. व्हाट हैपन्स, जो ऑटोनॉमिक न्यूरोपैथी है उसमें ऑटोनॉमिक नर्व जो होता है वो अफेक्ट होता है. ऑटोनॉमिक नर्व अफेक्ट होता है, मतलब सिंपैथेटिक नर्व, पैरासिम्पैथेटिक नर्व. ओके, सो ड्यू टू उसकी वजह से क्या होता है, ड्यू टू अफेक्ट ऑफ ऑटोनॉमिक नर्व्स there is a autonomic neuropathy. Okay, and because of that orthostatic hypotension develops, and in that condition ergot alkaloids, as they are alpha blockers, they are used in the orthostatic hypotension. Okay, they reduce the sympathetic tone. As they are a alpha blocker, they will reduce the sympathetic tone by depression of vasomotor center, and thus they will induce bradycardia, means less heartbeats, okay, than normal, by central vagal stimulation and direct myocardial depression. They also stimulate the CTZ, chemoreceptor activation. उसकी वजह से क्या होगा कि vomiting भी होगा उसमें. So these are not much important, but you should know. Then next one is the prazosin, parazosin, terazosin, doxazosin, alpozocin, tamsulosin. So these drugs are very important because they are going to ask the question on this portion, not on above portion and not on this portion. They are going to ask you what are the selective alpha blockers, what are their uses. Okay, so try to focus on this: prazosin, terazosin, doxazosin, alpozocin, and tamsulosin. So they are known as the selective alpha 1 blockers. Okay, they are known as the selective alpha 1 blockers. Okay, so when we are going to discuss antihypertensive drug, at that time also you are going to see these drug again. Okay, so here just remember, they will selectively block the alpha receptor, they will decrease the peripheral resistance, and that's why they will decrease the blood pressure. So they are used to reduce the blood pressure and used in the treatment of benign prostate hypertrophy. So it is just like a prostate cancer. Okay? Benign prostate hypertrophy, prostate gland जो होता है आपका उसका कैंसर मतलब benign prostate hypertrophy. Okay, so they are also used to treat the benign prostate hypertrophy. Why? Because your prostate gland has a alpha 1 receptor, and they are a selective alpha 1 blocker, so they will block the alpha 1 receptor in the prostate gland also, and they will prevent the whatever their alpha role of your alpha 1 receptor in the prostate gland, that will be prevented. Okay, so they are used in the treatment of benign prostate hypertrophy. So also they have favorable effect on lipid profile, means lipid profile जो है body का उसके ऊपर उनका beneficial effect है, means they will increase the high density lipoprotein which are beneficial, and they will decrease the LDL and TG triglycerides. So यहाँ पे जो selective alpha 1 blocker है उनका use क्या है कि they are used in the treatment of blood pressure, they are used in the treatment of benign prostate hypertrophy, that is a prostate cancer. Okay, remember इसके ऊपर एक बार क्वेश्चन आ चुका है. Again they will decrease your they will also increase the good cholesterol, that is a high density lipoprotein. इसके ऊपर भी बोल रहा हूँ मैं कि high density lipoprotein is a good cholesterol and low density lipoprotein is a bad cholesterol. कोलेस्ट्रॉल, इनको कोलेस्ट्रॉल बोलना उतना साइंटिफिकली क्लियर नहीं. So just call them as lipoproteins. So high density lipoprotein, they are good for body, and low density lipoprotein, they are increase in the level of low density lipoprotein. If your body has increased the level of low density lipoprotein, that means your cardiovascular system is in danger. Okay, if there is an increase in the low density lipoprotein in your body, so you are more prone to arteriosclerosis. Then again, tamsulosin and psilocybin, they act selectively on prostatic alpha 1 receptor, and therefore they are also used in the treatment of benign prostate hyperplasia. BPH. It is the same thing like benign prostate hypertrophy. They can, but their adverse effect is that they can cause floppy iris syndrome. Okay, floppy iris syndrome is associated with the tamsulosin and psilocybin. These are the selective alpha 1 blocker, and they tamsulosin, psilocybin, they are mostly used in the treatment of prostate cancer. Okay, जो prostate gland का cancer होता है, benign prostate hypertrophy or benign prostate hyperplasia, so they are used over there. Okay, they are not much used as antihypertensive, but they are used for their benign prostate hyperplasia activity. Anti-active means they are used in the treatment of this BPH, but they can cause floppy iris syndrome. That is one of the adverse effect if they are used in the cataract surgery. Cataract, आप बोलेंगे cataract क्या, cataract का क्या यहाँ पे relation क्या है? So cataract क्या होता है? If there is an increase in the intraocular tension or intraocular pressure. इंट्राऑक्यूलर प्रेशर कैसे बढ़ेगा? इंट्राऑक्यूलर फ्लूइड जो होता है आपके आईज में, आपके आई बॉल के अंदर एक कैविटी होता है, उसको बोलते हैं ऑक्यूलर कैविटी. So in that cavity there is one fluid known as ocular fluid. Ocular fluid, okay, aqueous humor बोलते हैं उसको, aqueous humor. Okay, so if there is an increase in the aqueous humor, so there will be increase in the intraocular pressure. Intraocular pressure increase हो गया मतलब आपको वहाँ पे काच बिंदु या मोती बिंदु हो गया. ठीक है, that is, so you have to remove that, you have to decrease that. So in that condition you can use these alpha blockers. So but they used to have one side effect known as a floppy iris syndrome. Are you able to hear my voice properly? Now next one is a tolazolin and pentolamine. देखो इसमें कैसा है, ईच एंड एवरीथिंग जो है आपके ड्रग्स के बारे में वो सब कुछ नहीं डिस्कस किया जा रहा है, क्योंकि वो उतना आप बुक्स पे पढ़ सकते हो बुक में, या फिर आपके कॉलेज में पढ़ाया होगा उसको. ठीक है, तो व्हाट एवर इज इम्पोर्टेंट फॉर जीपैट उतना ही लेंगे अपन, उसका ये क्या है वो क्या है वो नहीं लेंगे. टोलाजोलिन एंड पेंटोलामाइन. टोलाजोलिन एंड पेंटोलामाइन ये क्या है? they in addition to alpha blocking activity they can cause increase in the force of myocardial contraction and tachycardia. So tolazolin is a partial alpha 1 agonist. Tolazolin is a partial alpha 1 agonist. They are non-selective. Tolazolin and pentolamine. Therapeutic uses of alpha blockers. So जो भी alpha blockers है उनकी use क्या है? So they are used in the hypertension to decrease the blood pressure. Then they are also used in pheochromocytoma. Pheochromocytoma means increase in the your size of your prostate gland. Peripheral vascular diseases. Then benign prostate hypertrophy means prostate cancer. Then they are sometimes used in the erectile dysfunction. Then they are also used in the scorpion sting. Scorpion sting. Okay. So prazosin is a drug of choice. Okay. इसके ऊपर भी एक क्वेश्चन आ सकता है आपको. So alpha blockers are also used in the treatment of a scorpion bite. अगर आपको बिच्छू ने काट लिया तो बिच्छू ने काट लिया तो उसके उस टाइम पे भी आपको प्राइजोसिन यूजफुल है. बिच्छू ने काट लिया मतलब काट लेने के बाद बिच्छू का जो पॉइजन होता है, जो वेनम होता है स्कॉर्पियन का, सो दैट वेनम यूज टू डायलेट योर ब्लड वेसल, एंड एज देयर इज डायलेशन ऑफ ब्लड वेसल देयर इज इंक्रीज इन द परमेबिलिटी ऑफ ब्लड वेसल. सो जितना परमेबिलिटी बढ़ेगा उतना पॉइजन अंदर जाएगा. ठीक है, सो इन दैट केस यू हैव टू यूज अल्फा ब्लॉकर. सो अल्फा ब्लॉक किया तो ब्लड वेसल का कंस्ट्रिक्शन मतलब जो है ना, तो एब्सॉर्प्शन नहीं होगा उसका स्कॉर्पियन का पॉइजन का. सो अगेन prazosin is a drug of choice. Parazosin or prazosin is a drug of choice in the scorpion sting. Beta blockers, and these are the most important. Okay, beta blockers are the most important because mostly they are used as an antihypertensive drug. Okay, and nowadays they are very much popular in the therapeutics. So a lot of beta blockers are there which are used as an antihypertensive agent. Okay, or they will decrease your blood pressure. Okay, so you know that there is a beta receptor. There are different beta receptors. Okay, beta 1, beta 2, beta 3. Okay, so beta 1 is present in the heart, beta 2 is present in the your bronchi. Okay, beta 1 is stimulatory in nature, beta 2 is inhibitory in nature. Okay, beta 3 is present in the adipose tissue, and beta 3 is associated with the lipolysis. Okay, means those drugs which will increase the activity of beta 3, they are used in the treatment of your obesity. Okay, so that is another part, leave that. So here what is important, here your beta 1 receptor is important. Beta 1 receptor is present in the heart, and that is associated with the increase in the heart rate blood pressure, positive chronotropic effect, and positive inotropic effect. Okay, so if you block this beta 1 receptor, obviously ultimately you are getting a counteracting the blood pressure. Okay, so blood pressure क्यों increase हो रहा है आपका यहाँ पे? मैंने आपको पहले ही बोला है कि अगर सामने आपके शेयर है तो वो शेयर अभी नॉर्मल पहले जमाने में क्या होता था कि शेयर आने के बाद ये आपकी एक्टिविटीज मिल जाएंगी, आप भागने लग गई है, लेकिन आजकल वो शेयर नहीं है, आपको वो टाइगर रियलिटी में नहीं है, लेकिन वो टाइगर रिप्लेस हो गया आपके बॉस, आपके दुश्मन, आपके जेलसी, आपके हेट्रेड से. ओके, so you are getting stimulus, you are continuously getting adrenaline or adrenaline. Okay, so they are going over there on the alpha 1 receptor, beta 1 receptor, beta 2 receptor, and they are increasing the. अभी देखो adrenaline और नॉर एड्रेनलिन, कोई भी एक नॉर एड्रेनलिन, ठीक है, नॉर एड्रेनलिन will go on the heart beta receptor, it will stimulate, it is an agonist. Okay, so it will stimulate the beta 1 receptor. So what is the role of beta 1 receptor? It will increase the heart rate, it will increase the blood pressure, it will increase the force of contraction. So ultimately your blood pressure is increasing. So that's why you have to use beta blockers. So if you block the beta receptor, beta 1 receptor particularly, then your blood pressure will not go high, your blood pressure will come down. That's why beta blockers. Okay, now we'll see the classification of beta blockers. Before that we'll see the mechanism. So these beta blockers are the drugs which will block the action of catecholamines. Catecholamines means particularly adrenaline and noradrenaline dopamine. Okay, so these are the drugs which will block the action of these three neurotransmitters, that is noradrenaline, adrenaline and dopamine. Okay, they will competitively block it. Okay, and they have selective action on beta receptor, means they are beta selective, means they are not going to affect any kind of alpha receptor. Okay, so beta specific means beta receptor blockage, not all the kind of receptor. Like आपने देखा है एड्रेनर्जिक में दो टाइप के रिसेप्टर होते हैं, बीटा अल्फा, ठीक है, अल्फा एंड बीटा. सो बीटा ब्लॉकर्स मींस दे ओनली ब्लॉक द बीटा रिसेप्टर, नॉट अल्फा रिसेप्टर. ओके, so how they will block? By inhibiting the activity of cell membrane enzyme, that is adenyl cyclase. So they will inhibit the beta receptor by adenyl cyclase, by inhibiting the cell membrane activity of adenyl cyclase, and therefore decrease in the production of cyclic AMP. So decrease in the production of cyclic AMP, and later on they will not let the calcium ion inside the entry. ठीक है, सो कैल्शियम चैनल का एंट्री बैन हो जाएगा, बंद हो जाएगा. क्यों? ये एक नॉर्मली ट्रांसडक्शन मैकेनिज्म होता है. ठीक है, जो भी जी प्रोटीन के ऊपर रिसेप्टर होते हैं, दे आर नॉट एक्टिंग डायरेक्टली, दे आर एक्टिंग वाया सेकेंडरी मैसेंजर्स. तो कोई एडेनिल साइक्लेज का एंजाइम को ब्लॉक करेगा, तो अगर उसको ब्लॉक किया तो साइक्लिक एएमपी नहीं प्रोड्यूस होगा, साइक्लिक एएमपी नहीं प्रोड्यूस होगा, तो कैल्शियम का जो एल टाइप ऑफ कैल्शियम चैनल है वो वहाँ पे एंट्री नहीं होगा उसका, कैल्शियम का. अगर कैल्शियम एंट्री नहीं होगा इनसाइड सेल तो डीपोलरेशन नहीं होगा, डीपोलरेशन नहीं होगा तो एक्शन पोटेंशियल जनरेट नहीं होगा और वो एक्टिविटी कम हो जाएगा उसका. सो दैट्स हाउ दे एक्ट. नाउ क्लासिफिकेशन इज मोर इम्पोर्टेंट. ओके, इसके ऊपर क्वेश्चन आता है. देयर आर 3 क्लासेस ऑफ बीटा ब्लॉकर्स. सो फर्स्ट क्लास कार्डियो सिलेक्टिव बीटा ब्लॉकर. ओके, सेकंड क्लास नॉन सिलेक्टिव बीटा ब्लॉकर्स. Third class is beta blockers with additional alpha blocking activity. So first one is the cardio-selective beta blockers. As the name indicates, cardio-selective beta blockers means cardio-selective means heart selective. Okay, जो cardiac system आपका heart, तो mostly heart, उसमें blood vessel भी आते हैं लेकिन mostly heart. Because cardio-selective means heart has a beta 1 receptor. That's why cardio-selective beta 1 blockers, and they are also known as a second generation beta blockers. Remember. They are also known as the second generation beta blockers. Cardio selective beta 1 blockers, second generation beta 1 blockers. यहाँ पे थोड़ा उल्टा दिया है मैंने, लेकिन they are known as the second generation beta blocker. Which are they? They are nothing but the acetobutol, then atenolol, metoprolol, bisoprolol, ismolol. Okay, so these are the cardio selective beta blockers. Particularly atenolol, metoprolol, bisoprolol. Bisoprolol is a highly selective cardio-selective beta blocker, means they are going to block only beta 1 receptor. Remember, they are selective beta blockers, selective beta 1 blockers. Now non-selective beta blockers means they will block beta 1, beta 2, beta 3 or any एनी अमॉन्ग्स थ्री, कि कौन सा भी ब्लॉक कर सकते हो, नॉन सिलेक्टिव वो सभी को ब्लॉक करेंगे, बीटा 1, बीटा 2, बीटा 3. So though these are known as a non-selective beta blockers. So they will block beta 1, beta 2, beta 3. Okay. So in that also you have subtypes. So these non-selective beta blockers are known as a first generation beta blockers. Remember, non-selective beta blockers को पहला generation बोलते हैं. Non-selective beta blockers are known as a first generation beta blockers. Selective beta blockers or cardio-selective beta blockers, they are known as a second generation beta blockers. Okay. Now first generation or non-selective beta blockers में क्या है? So you have subtypes over there, 1, 2, 3, 4, A, B, C, D. So non-selective beta blockers are further classified into 4 types. So non-selective beta blockers with membrane stabilizing effect. So beta blockers with membrane stabilizing effect. For example, propranolol. This is a membrane stabilizing effect. So this propranolol has a beta blocking activity as well as membrane stabilizing activity. So non-selective beta blocker plus membrane stabilizing effect. Okay, membrane stabilizing effect क्या होता है? ये मैंने बोला है आपको when we was discussing local anesthetic. So they will prevent the entry of, but they will not affect the resting membrane potential. So if any drug is able to prevent the entry of cations inside the cell, but at the same time that drug is not able to disturb any resting membrane potential. So that is known as a membrane stabilizing effect. So this propranolol is a non-selective beta blocker along with the additional membrane stabilizing effect. Okay, ये सब important है, इसके ऊपर क्वेश्चन आता है. Then membrane stabilizing effect plus intrinsic sympathomimetic means beta blockers having membrane stabilizing effect plus intrinsic sympathomimetic activity. Most of them are the partial beta blocker, partial agonist of beta receptor. Okay, they are the partial agonist. Okay, so they will have membrane stabilizing effect as well as intrinsic sympathomimetic activity. But sympathomimetic activity is suppressed over the beta blocking activity. So example is oxyprenol and pindolol. So these are the beta blockers having membrane stabilizing activity plus intrinsic sympathomimetic activity. This is second class. Now third, selective beta blockers without membrane stabilizing activity or intrinsic activity. So selective beta blockers without action like timolol and nodelol. Then miscellaneous is also there. Example sotalol. These 4 category are their non-selective beta blocker or they are first generation beta blocker. But these drugs, acetobutol, atenolol, metoprolol, bisoprolol, ismolol, they are selective beta 1 blocker or cardio-selective beta 1 blocker. They are known as a second generation drug. Okay, they are first generation. These are the first generation. These are the second generation. Now third generation, beta blockers with additional alpha blocking activity. These are known as a third generation drugs. Beta blockers with additional alpha blocking activity, and you know that these drugs are having much potential application in the therapeutics because alpha blockers, you don't have to use alpha blockers with these drugs because they are already having property of alpha blocking. ये जो थर्ड जनरेशन ड्रग्स होते हैं इसमें 2 प्रॉपर्टी होता है. एक तो बीटा रिसेप्टर को ब्लॉक करेंगे, इन एडिशन टू दैट आपके अल्फा रिसेप्टर को ब्लॉक करेंगे. ठीक है, तो आपको जो उसका इफेक्ट है मतलब दो ड्रग देने के बजाय आपको एक ही ड्रग में मिल रहा है. सो अल्फा ब्लॉकर्स का भी एक्शन मिल रहा है, यहाँ पे बीटा ब्लॉकर्स का भी एक्शन मिल रहा है. सो व्हाट आर दोज ड्रग? दोज आर नथिंग बट द labetalol, then cardiovediolol, then celiprolol. These 3, remember, labetalol, cardiovediolol, then celiprolol. These 3 drugs, they are having beta blocking activity with additional alpha blocking activity. Remember, so they are alpha plus beta blockers. So you can remember selective beta blockers, cardioselective, atenolol, metoprolol, bisoprolol, ismolol, acetobutol. Then non-selective, your propranolol, then pindolol, oxyprenol, nodelol, and sotalol. Third generation, that is a labetalol, cardiovediolol, and celiprolol. You have to remember the classification because lot of time they used to ask the question on this. ये क्लासिफिकेशन एटलीस्ट 3 बुक में से लिया है, ऐसा नहीं कि ये किसी एक बुक का क्लासिफिकेशन। एक्चुअली इसमें सातोस्कर भंडारकर फार्माकोलॉजी उसका क्लासिफिकेशन है, केडी त्रिपाठी का क्लासिफिकेशन है, और आपका स्पर्श गुप्ता एंड गर्ग जो है उसका भी बुक में से क्लासिफिकेशन लिया है। मैं तीनों क्लासिफिकेशन बुक के कंबाइन करके ये क्लासिफिकेशन बनाया। यही क्लासिफिकेशन किया आपने तो आपको 3 बुक पढ़ने की जरूरत नहीं। फार्माकोलॉजिकल एक्शंस ऑफ बीटा ब्लॉकर, हाउ दे विल एक्ट on a different systems. Okay, so we will see pharmacological actions of beta blocker. So first is the membrane stabilizing effect. So propranolol, mainly propranolol and other some beta blockers have variable direct depressant effect on the heart. Okay, so I have explained you membrane stabilizing effect. So they will have membrane stabilizing effect on the heart. Then intrinsic sympathomimetic action. So some beta blockers have beta stimulant, okay, because they are a partial agonist to beta. So they are that is nothing but the intrinsic sympathomimetic activity. Some beta blockers also have beta stimulant activity, that is a partial agonistic property, and that is nothing but the intrinsic sympathomimetic activity. Primary beta blocking action of these drugs are in fact more responsible for the beneficial as well as adverse effect. Beta blockers with एडिशनल सिंपैथोमाइमेटिक प्रॉपर्टी जो है वो ड्रग्स जो है उसका जो बेनिफिशियल इफेक्ट होता है हाइपरटेंशन में या फिर जो भी एडवर्स इफेक्ट है दैट इज बिकॉज ऑफ मोस्टली बीटा ब्लॉकिंग एक्टिविटी नॉट सिंपैथोमाइमेटिक. देन नेक्स्ट वन इज व्हाट आर द इफेक्ट ऑफ बीटा ब्लॉकर्स ऑन सीएनएस. नाउ दिस बीटा ब्लॉकर्स दे विल हैव अ वेरिंग डिग्री ऑफ लिपिड सोल्युबिलिटी. उसमें कि कुछ ड्रग ज्यादा लिपिड सोल्युबल है, कुछ ड्रग कम लिपिड सोल्युबल है. एंड यू नो दैट there is a direct relationship between lipid solubility and crossing of blood brain barrier. जो ड्रग ज्यादा लिपिड सोल्युबल होगा वो ब्रेन में जाएगा. सो ड्यू टू लिपिड सोल्युबिलिटी these drug can cross the blood brain barrier and they will show adverse effect on CNS. Okay, so what are these? These are nothing but the mood alteration, anxiety. So that is produced by particularly with the propranolol. जो आपका प्रोपेनोल है वो करेगा मूड अल्टरेशन एंड एंजाइटी बिकॉज इट इज अ हाईली लिपिड सोल्युबल ड्रग. ओके, प्रोपेनोल तो हाईली सोल्युबल होने की वजह से वो सीएनएस में जाएगा, वहां पे एडवर्स इफेक्ट दिखाएगा. ये जो प्रोपेनोल है दैट इज बिकॉज ऑफ हाई लिपिड सोल्युबिलिटी, इट इज हैविंग एक्सटेंसिव फर्स्ट पास इफेक्ट. ठीक है, सो इट इज अ क्लास 1 ड्रग. बायोफार्मास्यूटिक्स में जो पढ़ा होगा आपने, biopharmaceutical classification of your drugs. So drugs having high permeability, high solubility, drugs having slow solubility, high permeability, class 1, class 2, class 3, class 2. Propranolol is a class 1 drug, high solubility plus high permeability. Because of high solubility, this propranolol has a CNS adverse effect as well as first pass effect. Atenolol has a less lipid solubility and because of which it has a less CNS adverse effect. नाउ इफेक्ट ऑफ बीटा ब्लॉकेज कि हार्ट में बीटा ब्लॉकिंग करने की वजह से क्या इफेक्ट मिलता है. सो इन प्रेजेंस ऑफ सिंपैथेटिक टोन, in presence of increased sympathetic tone means in presence of increased sympathetic activity. So these drugs will reduce automaticity of heart. These drugs will decrease heart rate. These drugs will decrease the myocardial contractility and in turns they will decrease the cardiac output, stroke volume. They will slow down the AV conduction, atrioventricular conduction. They will reduce myocardial oxygen consumption and increase the exercise tolerance. Means ultimately they are depressing your heart because of beta blocking activity. They are reducing the heart rate, myocardial contractility, cardiac output. They are slowing down the conduction velocity. They are reducing the myocardial oxygen demand, oxygen consumption. Okay, so ultimately they are reducing your blood pressure. So they reduce the blood pressure by their action on heart and reduction of cardiac output. They lower the plasma renin. Now they also decrease the plasma renin. Renin जो एंजाइम होता है आपका renin. Okay, so renin अगर ज्यादा सिक्रेट हो गया तो renin क्या करेगा? Renin will be converted into angiotensin by renin angiotensin converting enzyme. Angiotensin converting enzyme SECE. When we will see the antihypertensive drug, at that time I will explain this what is ACE and what are the ACE inhibitors. Just remember angiotensin, just remember renin एक एंजाइम होता है, वो अगर बढ़ गया तो उसके बाद में एंजियोटेंसिन बनेगा और एंजियोटेंसिन इज अ वैसोप्रेसर और वो ब्लड वेसल को प्रेस कर देगा, कॉन्स्ट्रिक्ट कर देगा और ब्लड प्रेशर को बढ़ा देगा. बीटा ब्लॉकर्स इन एडिशन टू ब्लॉकिंग द बीटा 1 एक्टिविटी इन द हार्ट, तो ये जो बीटा 1 ब्लॉकिंग एक्टिविटी उसके वजह से तो ब्लड प्रेशर कम हो रहा है, ठीक है, लेकिन इन एडिशन टू दैट दे विल आल्सो डिक्रीज द प्लाज्मा रेनिन लेवल. Selective beta blockers act on a heart. Non-selective beta blockers act on a additional like bronchi. क्योंकि बीटा तो रिसेप्टर तो सभी सब तरफ है ना. बीटा 1 is present in the heart, बीटा 2 is present in the lungs, bronchi. ठीक है. So selectively acting drug they will act on only on beta 1 receptor and non-selective will also affect on the bronchi. Now beta 2 receptor का रोल क्या है bronchi में? They will cause a bronchodilation, right? आप इतना याद रखो कि बीटा नॉन सिलेक्टिव बीटा ब्लॉकर्स उतने यूजफुल क्यों नहीं है कि नॉन सिलेक्टिव बीटा ब्लॉकर्स क्या करेंगे कि बीटा 1 को भी ब्लॉक करेंगे, बीटा 2 को भी ब्लॉक करेंगे. आपका प्रॉब्लम क्या है? हाइपरटेंशन. और हाइपरटेंशन क्यों हो रहा है? बीटा 1 रिसेप्टर की वजह से हो रहा है, क्योंकि बीटा 1 रिसेप्टर का एगोनिस्ट एड्रेनालिन नॉर एड्रेनालिन क्या करेगा, वहां पे बीटा 1 को स्टिमुलेट करेगा और बीटा 1 क्या करेगा, हार्ट रेट इंक्रीज कर देगा, ब्लड प्रेशर इंक्रीज कर देगा, कार्डियक आउटपुट इंक्रीज कर देगा. ठीक है, तो इसकी वजह से ब्लड प्रेशर इंक्रीज हो रहा है. अगर कार्डियो सिलेक्टिव दिया आपने तो दैट्स ओके. मतलब कार्डियो सिलेक्टिव मतलब क्या? क्लास सेकंड जनरेशन ड्रग, दैट इज अ कार्डियो सिलेक्टिव बीटा ब्लॉकर लाइक metoprolol, then acetopetol, then your atenolol, okay, then bisoprolol. They have no problem, they will go and block the beta 1 receptor selectively. But what about the non selective beta blockers? अगर नॉन सेलेक्टिव बीटा ब्लॉकर्स दिए आपने तो वो बीटा 1 को तो ब्लॉक करेंगे लेकिन बीटा 2 को भी ब्लॉक करेंगे. और बीटा 2 कहाँ पे है? ब्रोंकस में. और ब्रोंकस में उसका रोल क्या है? डायलेशन ऑफ ब्रोंकाई. ठीक है, लेकिन आप क्या कर रहे हो? ब्लॉक कर रहे हो. मतलब वो क्या करेंगे? कंस्ट्रिक्शन ऑफ ब्रोंकाई व्हिच इज नॉट डिजायर्ड. ओके, सो दैट्स व्हाई सिलेक्टिव बीटा ब्लॉकर्स दे आर यूजफुल इन द हाइपरटेंशन, द पेशेंट हैविंग हाइपरटेंशन एंड अलॉन्ग विद द अस्थमा. ठीक है, अगर किसी को अस्थमा है और उसको अपने नॉन सिलेक्टिव बीटा ब्लॉकर दे दिया, तो एक पेशेंट है, मान लीजिए एक पेशेंट को अस्थमा भी है और उसको ब्लड प्रेशर भी है, तो उस टाइम पे आपने उसको नॉन सिलेक्टिव बीटा ब्लॉकर दे दिया तो क्या होगा? उसका ब्लड प्रेशर तो कम होगा लेकिन उसका क्या होगा? अस्थमा बढ़ जाएगा बिकॉज ऑफ कंस्ट्रिक्शन ऑफ दैट ब्रोंकियल्स. मतलब बिकॉज नॉन सिलेक्टिव बीटा ब्लॉकर्स क्या करेंगे? वो बीटा रिसेप्टर जो 1 है बीटा 1 हार्ट में वो भी ब्लॉक करेगा और दूसरा जो बीटा 2 है लंग्स में आपके ब्रोंकाई में वो भी ब्लॉक करेगा. तो बीटा 1 ब्लॉक तो आपको डिजायरेबल है, वहां का एक्शंस चाहिए आपको, लेकिन बीटा 2 का एक्शंस नहीं चाहिए. अगर बीटा 2 का एक्शंस उसने लिया तो दैट विल बी एडवर्स इफेक्ट. सो दैट्स व्हाई मोस्ट ऑफ द नॉन सिलेक्टिव बीटा ब्लॉकर्स विल हैव they are contraindicated in case of asthma. Selective beta blockers will act on heart. Non-selective beta blockers has additional action on bronchi. They will increase the airway resistance. They will cause constriction of your bronchial muscle and they will narrow the bronchial airway. So they will cause airway resistance, which could be dangerous in case of patient with asthma. And that's why beta non-selective beta blockers are contraindicated in the patient with. So in that case, you have to use selective beta 1 blocker. So that is how they will reduce your blood pressure. So metabolic effect, they are capable of altering and modifying the carbohydrate lipid metabolism. They also increase the level of natriuretic peptide.